Hello guys, welcome back again. So, I was talking about the the pathologies, right? And I remember stopping at histopath. So, basically, I'm going to pick up from there. Uh, I just had to go off because of some certain reasons. So, I was saying histopathology happens to be like the bulkiest of them all, and the advice I would give is that just make sure you do what is expected basically. So you'll be expected to do like practicals, you'll be expected to do gross and as well as microscopic practicals. So just make sure to do what is expected. Like um do your best. For us, we had extensive slides and lectures. So what we thrived on was basically reading our lecture notes and as well as attending lectures, because Robbins is actually huge. Robbins is the gold standard. Please, if you have not watched my previous live, you can catch up there because I spoke on hematology and I started speaking on histopathology until I went out or I went off. That's why this one is Let's Talk Pathology too, right? So, basically, the course, right, is very bulky. This textbook of choice is Robinson Cotran, and that is very bulky. In my previous live video, and I said I'll be doing more live videos because I feel like I have to drop this update soon. I really cannot start, you know, editing the videos now because, like I said, a lot of things have been happening in Nigeria and it has actually like left me distraught, right? So what I'm trying to do now is I'm trying to, just drop this information here so that at least you would have something that you can start running with up until when I'm able to, upload these videos. So basically, Robinson Cotran is very huge, you guys. So you can save yourself time by first off being in the lectures as well as um doing your practical work, right? Like for our school, the course is very bulky, and the lecturer has taken it. They actually understood that this course is actually is too much. It's too much to be covered in this span of time. So basically, there were certain things that they expected us to know, and they didn't go outside what we were taught, right? So first off, like I said, general pathology, build your general pathology. Like make sure your general pathology is solid. Like make sure it is solid, because sometimes even in exam, maybe your viva or your oral exam, what happens is that if they're asking you questions and you're not forthcoming, they switch to general because they believe that general is like the fundamentals that everybody should have. Everybody should know what inflammation is. They should know the cardinal signs of inflammation. They should know what a thrombus and an embola is. You should know what a granuloma is, because those are the fundamentals of general, right? Especially inflammation. To be honest, if you understand the whole concept of inflammation, right, it helps you in understanding some systemic pathology, because most systemic pathologies, right, they are based off inflammation. So if you understand like the basis of inflammation, I think you're covered for most pathology that will involve inflammatory response, right? Like tuberculosis and the rest. So basically, just have a baseline understanding of what is expected, like, and do what it is expected. For me, I'm a audio visual learner, so I spent a lot of time kind of like watching videos and listening to audio recordings, but I mostly did videos, to be honest. For histopathology, I would recommend Pathology in a Nutshell. The Is a channel here on YouTube. You can start watching that. Dr. Ben James is a consultant in my school, and he has a YouTube channel here, and he has a lot of videos on general pathology, which was very, very helpful. Like it was very, very helpful, guys. You don't know how helpful those videos were to me. Like they were very helpful. So you can start off by watching all of his videos. He covers general pathology and it gives you a basic fundamentals of what you are expected to know. Then there's also I Love Pathology. I Love Pathology is also a very good YouTube channel that I would ask you to subscribe to. They do beautiful videos, and it's not only general pathology that is done on that channel, but like you can watch that. Then there's also Dr. Gibran Ahmed, also on this YouTube. The issue I had with his videos were they were quite long. Okay, they were long, and sometimes, you know, like it was based off Robbins. Yeah, I agree it was based off, which was good, but I think it was the length that was really an issue for me. Then there is also another channel. I've forgotten the name, but the channel, whether it's morphology, the channel basically focuses on morphology in terms of systemic histopathology. So it focused on morphological changes, like for example, under pneumonia now, when they're talking about the morphology, so they will basically tell you the pathophysiology and morphology. And one thing I did not understand was that when it came to systemic pathology, for a pathologist, the most important thing for them is pathophysiology and morphology, right? Other things are important. They're also interested in your treatment plan. If it's cancer, they're also interested in your staging too. You want to know if you can stage cancer, all of those things, right? It's good you know it too, but like for them, they are most interested in your pathophysiology and your morphology. They want to understand if you have an understanding of the progression of the disease. Do you know what are the outcomes or the fate of a patient having this disease, what it results to? That was their major concern, right? They were not really interested in treatment. To be honest with you, they were not really interested in treatment, but you would definitely have to write something on under treatment, but they don't expect you to write medicine type or surgery type, like what medicine and surgery will expect you to write for treatment, right? You just wanted you to highlight the core important things and move on, right? Even prevention. Funny enough, a lot of emphasis are now being put on prevention, right? Especially for microbiology. Microbiologists don't joke with their prevention because some of the infections can be prevented, right? So they would want you to actually build up prevention, especially when you're dealing with parasitology. Under parasitology, you'll be expected to, talk about certain preventions, like how can some of these parasitic infections and most of the time it usually start. So now back to histopathology, like they are now becoming interested in prevention. If you're talking about a cancer and you know that it is preventable, please, especially when you're talking about cervical cancer, you know that it's prevented by HPV vaccine. So like they would want you to write about that. And normally when you're talking about prevention of any disease, you have to talk from basically the primordial, the primary, the secondary, and the tertiary. So primordial is you preventing the risk, then primary is you preventing disease, secondary is you preventing complication, and I've mixed them up. I know primary prevents you from getting the disease, that is you have the risk factors and all, but you're preventing the disease. Secondary, you have gotten the disease, you're treating the disease and preventing its complication. Then tertiary is that you are treating its complications and all of that. So basically they want you to go through this step ladder approach for whenever you're talking about whenever you're talking about prevention of any disease. So that is it. Then of course, if we now come to systemic pathology, there are key channels, right? There's pathoma. I didn't joke with my pathoma. Don't joke with pathoma. Pathoma is such a good resource. It's a very good resource for histopathology, systemic especially. Like even their general, they have good general. What am I even saying? If you want like something that summarizes both general and systemic, do pathoma. Pathoma is a good resource, but just that you might not necessarily find it on YouTube. To be honest, you can try and check. Um, is by Dr. Hussein Isatar, right? So like you might not necessarily find them on YouTube, but I'm sure if you check around, maybe even Telegram, you'd find, because I know on Telegram there are some of the videos are there and all of that. So I know that it was really helpful. Like the videos aren't very long, but they give you a good understanding, a good grasp, right? And like for USMLE students, but medicine is universal wherever you go. So there is that. Then what else? These are some of the channels that comes to mind because I actually like utilize these channels as much as I could while preparing for my examination, and they turned out very helpful, right? Like I said, now when you're studying histopathology, right, systemic approach, I've talked about general. I say for general you have to know everything, to be honest. Under general you have to know everything. Try and understand the fundamentals. The general topics are not much. The first few topics are the high yield ones. They, I don't know for other schools, but for my school, they will not necessarily ask you on nutrition or childhood or like pediatric tumors or like the last topics in Robbins general. So our school, we follow how Robbins is like outlined. So the last two topics I think is on childhood, on nutrition, and something environmental. They will not necessarily ask you essay questions on those things. So they might ask you MCQ questions, but they will not ask you essay questions. What they would focus on are the other part, like especially inflammation, very high yield. Inflammation is very, very high yield, right? Then, so when it comes to systemic, when you're going system by system approach, it is very, very important that you pay attention to diseases that are predominant in your region. So, example now, when you're doing cardiovascular pathology, pardon the noise you're hearing, I can't really control a lot, right? So when you're doing cardiovascular um pathology, right, there are key topics under cardiovascular pathology. One is hypertension. You know, like especially in Africa, right? Most Africans are suffering from hypertension. So you know that it's a very important topic and you should know the topic in depth, right? Another thing is atherosclerosis. I was asked atherosclerosis in my Viva, like that was what one of the questions I got, right? Because that tells you how predominant it is. Then we have now a lot of emphasis are also being put on congenital malformation when it comes to the heart, right? And now this is important because of the pediatric population, right? They usually have all these ventricular, these septal defects, atrial septal defect, and ventricular septal defect. Those are congenital malformations. So what I'm just trying to say is that you should pay attention to what is predominant in your region. If you're confused as to what to do, ChatGPT is your friend. I use ChatGPT. In fact, I learned majority of what I know from ChatGPT, right? From typing different prompts, asking ChatGPT to generate questions for me, asking ChatGPT to summarize certain pathophysiology as well as morphology for me, asking ChatGPT to provide me with mnemonics and all of this to better aid my memory. So like ChatGPT has been a game changer for me. Back to what I was saying. You can ask ChatGPT, well, what are the core topics that I'm supposed to know under this system in histopathology, right? Then it would outline it for you that okay, you're meant to know this, you're meant to know this, and you're meant to know that, right? So now what this helps you do is that you focus on reading this because these are what is prevalent in your locality. So start off with doing what is prevalent in your, like me, I'm in Nigeria now and I've given you examples. Like these are some of the diseases that are prevalent under cardiovascular disease. Then when you come to renals, now I know nephritic syndromes. Those are they are rampant also. So like those are things that I know that are important, right? Before even all these male genital what do they call it, where you have hypospedia and epispedias, and those things are important, especially for the pediatric population. So when you're looking at it, you should be like, okay, what is prevalent to adults, what is prevalent to elderlies, and also in children, because your questions will most likely start with what is popular, as they usually say in medicine, common things occur commonly. So they will start off with things that are usually common, right? That does not mean that you might not have few ectopics there where they could ask you things that are not common in your locality. So that is it for histopath. So use your chat GPT very well and just do what you're told. Try as much as you can. If you can read Robbins, please, I would recommend basic Robbins. So I got Robbins Acotran, the big one, and now it's just lying there because I'm like, what am I going to do with it? I couldn't finish it. The book was too voluminous. I really took my time. I know that I read it a lot during my break, right, before resuming 400 level. I did read that, and okay, it was helpful, but like it has too much stuff. Except if you're planning on going into pathology residency, I don't see an essence, to be honest with you. I think your basic Robbins is good enough for you. It has the core concepts, and yeah, that's it. So next thing I'm going to be talking about, I'm going to talk about microbiology. So microbiology is, for my school, microbiology is like one of the easiest pathologies, right? And why it is easy is not because of like the workload, because if it's by workload, like microbiology is like one of the toughest, but it's by the people in the department. They will teach you, they try their best, honestly, especially when it comes to parasitology taught by Dr. Dahal. He will try his best, he'll give you the most absurd examples just for you to be able to understand these things. And up till now, I will never forget some of the things he said in class when he was talking about Giardia lamblia, and he was talking about people going into the bush to defecate. Pardon me, I don't know what to say, but I just have to give you this story. He was telling us about how people go into the bush to like defecate and they end up passing foul, smelly, fatty stool. And why they had to go into the bush is because whenever they use the toilet, like they keep flushing and flushing and flushing, and the stool wouldn't go away because it was very fatty, it was very oily, and water doesn't mix with oil, so they just resorted to using the bushes. And all of this started when they consumed some unprocessed meals like that. So like from his story you would know, like, okay, Giardia lamblia, it causes gastrointestinal symptoms, and the feces is described as foul, smelly, and it is fatty. So basically, it's affecting this. So basically, you'll be able to tie 1 plus 1 and 2 together, right? If you like fully understand um microbiology. So, but microbiology, right, is divided. Under microbiology, we have virology, we have parasitology, we have bacteriology, we have immunology, we have mycology. So it's like 5, if I'm not mistaken, right? And the bulkiest of them all is bacteriology and parasitology. Okay, the three bulkiest in order of like which one is bulky is bacteriology, then parasitology, then virology. So these 3 courses are like the bulkiest of them all. I know my bacteriology, I didn't even finish. Like it was a lot, and I didn't really like how microbiology was necessarily taught in my school. It wasn't like, for me, I felt like microbiology should be taught in blocks, to be honest. I don't know if anybody will recommend this or if anybody is listening to me in power or any of that, but I think for microbiology it should be taught in blocks. They started doing that though in our blog posting, but during our classes it wasn't taught that way. So what happens is that this week they'll teach you virus, next week they'll teach you fungi, that's mycology, upper week they'll teach you bacteria. So it was scattered, right? But I think the right approach is that we can do 1 month for bacteria, 1 month for fungi, 1 month we can do that, or fungi 3 weeks, because fungi is not a lot, so we can do 3 weeks. But basically, let it be like, if this month I'm focused on bacteria, let me only be focused on bacteria. Not like I'll do bacteria today, then tomorrow I'll be doing something else, then next tomorrow I'll be doing something else. So I know that was a very big hustle for me, because like my mind was everywhere. But when we started doing blog posting and they stuck with the blogs, what they did was 1 week. So, but it wasn't fair. It wasn't still enough, because you feel very overwhelmed. Bacteriology has close to 50 something or even 60 or 70 something topics, so under bacteriology alone, and you're finishing that in 1 week. So it was crazy. But if you give one advice I would give is that if you want to ever be good, if you ever want to be good in if you ever want to be good in okay, so if you ever want to be good in if you ever want to, okay, somebody sent me, said hi, Patience, thank you for joining my live. I really appreciate you being here. If you have any questions for me, you can leave it in the chat box and I will get to it. I don't know why I can't like. I wish I can like I can like your comment. So so guys, thank you so much for joining. I make people have a lot. I make people have a lot of people in their life. Like, live life. Hi, Patience. Thank you. Please help me share. Help me share my live. I really don't understand. Please help me share my life. Thank you. So, back to what I was saying. So basically, a lot of people. What was that even saying, sir? So, for microbiology, it's best learned in blocks. To be honest with you, so if you learn your microbiology in blocks, like, you would understand a whole lot better than if you're trying to force yourself to learn it haphazardly, right? So there is a structure. So if you're doing bacteriology, focus on bacteriology. You're doing virology, focus on virology. So I'm going to be telling you some of the books I read, right? So for bacteriology, YouTube channels are key, to be honest with you. YouTube channel, because I'm a visual learner, right? And the one that I would recommend is Med Zukruf here on YouTube. Her channel's name is Med Zukruf. She has bacteriology video as well as parasitologist video. Her videos are moderate and there are a lot, right? But if you watch all her videos, you'll be good, honestly, with microbiology. Her videos are top notch. They explain very well. They give you everything that you need. This video for she only has videos for parasitology and bacteriology. Those are the ones that she has videos for. Um, guys, give me a moment. I think my network is cracking. Guys, hear me? Okay. Guys, hear me? Okay. I would presume that you can hear me. So, what was I saying? So I was saying that Medzukruf, she has videos on bacteriology and parasitology. So if you watch all her videos, you would cover majority of bacteriology and what is important. Because her videos kind of like they focus on what is important. Because microbiology is very wide and not everything is important too, but like there are things that are of like very high relevance. There are things that you should know, right, for every bacteria. Now, so I would recommend her channel. Then for books to read, I know I loved reading Essential Microbiology. I think there's an Essential Microbiology. I know I read that, the Indian one, and I didn't read the one that, because it's now two. I found out that like there are two editions. There's one where the topics are divided into systems, and there's another. I didn't like that one. I don't like the concept of dividing microbiology topics into systems. I understand it, but I don't like it, right? What I used the other edition where it was more bacteriology in one section, then parasitology in one section, then something like that. So that was very helpful. Then Levinson is a good book, to be honest with you, but Levinson was too summarized for us. I know people say Levinson is the standard book because that is what is used for USMLE exams. But it's big, the book is big, but like it didn't have a lot of information. In fact, some of our class notes were more detailed than that textbook. So there's that. So then that was for majority of it, because I also use Essential for virology. Then there's video resource, right? Video resource. I watched Sketchy. I know that access to Sketchy now you have to pay, and you might not find their videos on YouTube, but I think there's Picmonic is free also. So what they do is that they use stories like visual cartoon characters to explain some of these bacteria or parasites or viruses. They will give you a beautiful story around it so that you don't forget. So once you remember the story, like you'll be able to remember the bacteria and the treatments and everything just from remembering the story. So Sketchy actually helps. Sketchy and Picmonic. I think Picmonic does the same thing. Then there's one again for virology. So you can check on YouTube to see some of these, videos, right? Then for mycology, I know there was a guy, there was this Indian channel that I came across. I don't know why I can't remember their names now. But what he does was that he the only issue I had with his channel was that his voice was low. Like the voice was low, but like his videos were very good for mycology. Mycology is not a lot, to be honest with you. Well, I don't know. Maybe it's how we're taught, but mycology wasn't a problem because it wasn't much. So you can you can actually check on YouTube for his channel. It's not only mycology he does, but like I've forgotten what his channel was called. But once you find his channel, like you can't go wrong. Like he does very beautiful videos on mycology as well as other parts of microbiology. Then there is also, but these are like video resources. Then for immunology I use Kaplan. Kaplan's lectures. To be honest, if you don't have time, don't stress yourself. Don't stress yourself. Because like Kaplan's lecture videos for immunology, they were a lot. There were so much videos on immunology, and they were in depth. Like it was like you are studying down to gene rearrangement. Like that's what I'm saying for immunology. Like if you don't really have that time, don't bother yourself, don't stress yourself that much. Instead, just you can read Levinson. I know I enjoyed reading Levinson, especially the complement system and all. You can read Levinson and you can watch videos on here. There are immunology videos on here on YouTube too, so you can watch that, right? For us, immunology wasn't a problem because the prof was kind enough. Please, thank you for joining my live. Do make sure to hit the like button as well as leave a comment down below of what you want me to talk about. So, Prof Okolo, that man was so nice. Like he was more interested in on us understanding than for us to even read. So he had good lecture slides, though they weren't very detailed, but it was just enough for you. Then there were certain things that we will expect you to know, and he will tell you these things. Expect you to know differences between this and this. Expect you to know this. So like when you're reading, you know his expectations, and you're like, thank you for joining my live. Do hit the like button as well as leave a comment down below of what you want to talk about. So he was really, really nice, Profokolo. He was very nice to us. Sometimes he will tell you what he expects and what he wants us to know, right? And eventually in our blog posting, he even gave us a list of topics and all of that we're meant to know. So basically, immunology and mycology are like the simplest parts, to be honest with you. They're like the simplest parts. So if you have that one on lockdown, um you're fine. The ones that really stresses people are the first three I mentioned: bacteriology, parasitology, and virology. For parasitology, and one advice I give my friends, and I'll also be giving here, is that for microbiology, always start with classifications. Always start with classification. I used to say all road to microbiology starts with classification. For virology, you should know Baltimore's classification. For parasitology, you should know how to classify parasites. For bacteriology, you know how to classify bacteria, cocci rods, gram negative, gram positive, gram staining, right? All roads, like I say, start with classification. Mycology, you should know how to classify fungi. Um, Basically it's just immunology, maybe there's nothing to classify like that, but the rest always start with classification. Especially for virology, you will see the importance of Baltimore's classification of viruses. You can write a whole essay from just knowing which family it belongs and what class it belongs. So like classification is key. So if you want to be good in microbiology, start with classifying. Once you know how to classify, then you can start your readings from there. Then for microbiology, it involves you practicing, and like I said, once you're able to classify, right, you know that, okay, like for me now, I know that Ebola virus belongs to Filoviridae, and those are negative sense single-stranded RNA, right? And I know that they are what you know as the viral hemorrhagic fever, and I know that it is not only Ebola virus that is there. I think even I've forgotten the other one, and I don't want to say Bunya because I'm not sure, right? Also belongs there. They are like siblings, so you know that their pathogenesis are somewhat similar. Then you should know you should know viral replication and stages of viral pathogenesis, because that was how you explain all your essays. That's how you explain from entry. What happens at what sites? How does it enter? Where does it multiply? How does it spread? Where you have primary viremia, secondary viremia, all those things are important. So that is it for microbiology. Then once you're able to understand, microbiology is actually a lot. It's a lot. It's as bulky as histopath. Then for parasitology, I read one Panica. I read Panica's textbook of parasitology. That was the most insane thing I did. I read that book. That book was over 200 and something pages. I read everything in 1 week. And I said that was the most insane thing I did. Because for me, looking back, I'm like, it wasn't really so necessary, but it was just something I wanted to do. Because I enjoyed reading parasitology. I enjoyed the lecturer that taught us parasitology. He did a great work at it. So I just wanted to understand parasitology for myself. And it was the HOD, right? And his questions will always carry bulk of marks. So I spent my whole 1 week reading that book. Sometimes that's why looking back, I'm like, sometimes don't stress yourself. You can just, you can basically just read what you have, read the lecture slides and all of that. But if you have time, you can try it. The book's name was, the author is Panika, textbook of parasitology. It's an Indian book. So I read that book. It was a lot though, because there are some parasites that are not, I'll not say they're not relevant, but they're not prevalent, because some are only seen in some are only seen in immunocompromised patients like Balantidom coli, or like you're talking about Cryptosporium. I've forgotten the other name. Cryptosporum something, sha. Or you're talking about toxoplasmosis. Those ones are usually seen in immunocompromised patients, right? So now those will help. That reading that book also helped me. So like I said, start with classifying. From classifying, watch videos. Like me, I was an audiovisual learner, and I recommended some videos on this live. I said that you can do med zukruf, good for bacteriology and parasitology. You can do sketchy, pick monic. I told you sketchy is paid for, but I'm sure if you search, there's always somebody that has sketchy. There are always links to sketchy. If you want me to link that, maybe I would consider linking that for you. Then this Telegram too. You can check Telegram channels too. Then on YouTube too, there was a channel for mycology, but it does microbiology as a whole. I've forgotten the name of the channel. Check that out too. Then for immunology, you can find, I like immunology. I watched Kaplan, and Kaplan's video were too detailed. If you have time, you can check that out. If you don't have time, just check random videos on YouTube. You'll find something on immunology, and you can read. The textbook I used was Essential Microbiology, not not the recent edition, because the recent edition is divided into systems. I went with the older edition, where we had more of division into the various parts of microbiology, parasitology separately, mycology separately, and bacteriology separately. That is the one I used. I didn't use systemic division, the latest edition of Essential Microbiology. So that is good. Then Levinson is good, but there's some part of Levinson that are too brief. Really, us in the tropics. Us in the tropics, we are plagued by parasites, right? So parasitology is content heavy for us, right? So, but Levinson they just tried. Jawet is even the worst. I think Levinson tried. Jawet parasitology is like trash. Very summarized, very brief. But like I said, for us in the tropics, it's very heavy for us to know these parasites and all of that. So I don't even recommend Jawet. I didn't like Jawet. I didn't like the font sizes. Then there's an important book. Oh, I almost forgot. There's this book, Medical Microbiology Made Ridiculously Simple or Easy. Yeah, Made Ridiculously Easy. It's a good book. I read that book before I started microbiology, and it was very good. It was a good book. Some of your lecturers will say they don't like the book and all of that, but like for me, I believe that learning is personalized. Learning is for you. So anything that helps you learn better, please, I would say go for it. Like if you know, like, okay, this is what is going to help me, and you know that it's made ridiculously easy, that'll help you, please go for it too. Then read your lecture notes, obviously, to supplement, because what the book does is that it uses some anecdotes, like it tries to, paint scenario. Thank you so much for liking. If you have any question, you can leave it in the comment box and I will get to it. Thank you for joining my live. So basically, like, it's thank you for joining my live. If you have any question, leave it in the chat box and I would get to it. We're talking pathology now, so microbiology. So basically, they try and create some funny scenarios around these things, and they would just look for a way to infuse the knowledge in your memory. They use, like, I don't know, funny stories and cartoons. So microbiology made ridiculously easy is a student's best friend. Though, like I said, the lecturers don't like the book. They will tell you not to get it and all of that. But like anything that helps you learn, please take it. And Medzukruf, like I said, is very good. So I think I've spoken at length on this microbiology topic. All right. Overall, microbiology is easy. Just put it in your mind that the course is actually easy. And for us, like I said, our lecturers were of our best interest. They weren't out to make us feel or any of that. those things. Then past questions. I think at this point, everybody should know that for every pathology, you should have like a question banks from your seniors, and you should go through these questions to see what is usually repeated. Like for microbiology, I found out that for our school, like microbiology is repeated. Well, they always add new things to the questions, but like their format is quite the same, and the questions they ask are quite the same, right? So basically, if you have understand, if you are able to get past questions, go through these past questions, like it will really really help you a long way to prime your brain for how they usually ask their questions. It will even, and sometimes it's even repeated, so you would eventually pass. So at the end of the day, that was it for microbiology. Initially I was very scared because it was very bulky, too much information, a lot of stress is involved. But like at the end of the day, I realized that it's not as difficult as people make it seem. It just that it requires time and effort, right? Then I've talked about histopathology, I've talked about hematology, I've talked about microbiology. Now I'll be talking about chemical pathology. Chemical pathology was one pathology that stressed me. If you are looking for which pathology stressed Akman, award goes to Hema and chemical pathology. They stress the hell out of me. First off, chemical pathology is like, I used to say, it's biochemistry on steroids. Advanced biochem, one. And number two, it's more, but I think chemical pathology is like the bedrock of medicine, because it's from chemical pathology that you understand how to interpret lab results, right? Renal function tests, liver function tests, um, hormonal assay. You learn how to interpret those things from chemical pathology. Aside, but full blood count, the rest you learn it from hematology. Then serological testing, you learn it from microbiology. So basically, all of them are working hand in hand, to give you like understanding of laboratory medicine. So for chemical pathology, the issue I had with it was that because it was a bit scattered, it wasn't systematic like the rest, and it just, chemical pathology cuts across every course. Because at some point we were doing pediatric medicine, we did geriatric medicine, it cuts across everything. So that was the issue with chemical pathology, right? But for chemical pathology, there are key concepts. So now the advice I would give is that try and have an understanding of all the key concepts. For a chemical pathologist, what they're interested in is your understanding of obviously pathophysiology as well as biochemical features. So they want you to explain to them what are the biochemical features seen in this patient and why. If you're saying there's hyperkalemia, okay, why? And if you know the values, they're usually impressed with values. Like if you can tell them, okay, if it's greater than 5.5, it should be hyperkalemia, and the unit too, minimal equivalent per liter. Like they want you to say everything with the unit. They don't joke with their unit too. If you write a value without a unit, you've basically failed that question. So they don't joke with their unit. And like I said, they would want you to tell them why. Okay, why are you saying this? Like, what is the reason why? Right? And so they are interested in your biochemical features. Okay, as a result of this pathology, what happens to these patients? Can you list out the biochemical features that are seen? Can you list out the clinical features that are seen? Biochemical features are like the derangement in electrolytes, pH, whatever that is usually seen, right, with their values and maybe reasons. Then clinical features are like the manifestation, physical manifestation of the disease, right, that is seen. So basically, they would want you to write on that. Then how we're taught was that, okay, if you are given a case scenario about a patient, you should like answer the question like how you would answer a normal medicine question. So you start with history, examination, laboratory findings, then you talk about maybe diagnose, because most of the time they'll ask you to diagnose the patient from certain lab investigation as well as manifestation, clinical manifestation, right? I know for exam, Addisonian crisis, Addison's disease came out, right? So it was a case scenario. They'll give you everything. It was hyperpigmentation. When I even saw hyperpigmentation, I saw, is it bradycardia, I saw low blood hypotension, I saw all of this. I was like, this is most likely Addison. This is most likely Addison. So they would want you to know, actually, cause they also would like you to know like the causes of certain pathology. And for them, one of the important things is for you to be able to group them, like group causes, right? So most of the time there's primary and the secondary cause and all of these things. So they want you to know how to properly group, categorize things. They want you to have to demonstrate good reasoning, right? They want you to like to be honest, right, what stressed me was the bulk. Like chemical pathology was very bulky. It cuts across everything, and the information was just a lot. So the advice I would give you going into chemical pathology is that just have baseline knowledge of every topic. Know what are the fundamentals. Because like for me, but chemical pathology is a course that you can spend all your time reading, and you enter exam hall and nothing that you read is asked. That is just the truth, because it's a test of knowledge. It is a test of understanding. It's not a test of how much thing you've read. It's more like did you understand what you read, right? So it's not just cram I'm going to pour. You have to have understood it down to the T, right? So sometimes try as much as you can go online. Like for me, what I used to do back then for the MCQ questions, I would go on ChatGPT and I'll ask ChatGPT to set questions, USMLE standard, PLAB standard on so topic in chemical pathology, and it does it, and I'll be able to attempt these questions. These questions are usually tough. To be honest with you, our toughest questions were in our MB exam, which is our professional exam. It was actually chemical pathology. The questions were really tough. We had different paper types. It was a lot. It was a lot. Even hematology became nicer in the exam because they have done their worst. I feel like they have done their worst. So at that point they were like, we have really stressed these children a lot. Let's just give them something that they could answer. But chemical path, headache, and I didn't eat that day before the exam, and also the kind of headache I was having in the hall, it was insane, you guys. It was insane. Now I'm thinking about it. I'm like, thank God that phase is over. Then, but the essay was my best bet, which means that was what I gave. There was a question on liver function test. There was a question on hypoglycemia. There was a question on Addison disease. There was a question on physiological variables that affect sample collection. Like their questions are from everywhere. So basically, like I said, just have understanding. Even electrolytes derangement too. You should also have understanding of okay, which electrolytes can be deranged, and things like that would really help go a long way with chemical pathology. Then for the practical aspect, now I don't know, this might be peculiar to my school, I don't know for your school, but for chemical pathology you're expected to know certain equipment used in the laboratory. You're expected to know like factors that affect physiological, like sample collection. So normally sample collection is divided into there's the pre-analytical, analytical, and post-analytical phase. Then in the pre-analytical, there's pre-collection and collection. Under pre-collection is where we have things like fasting, patient preparation. Basically, that's what you're doing in that. Then, so now chemical pathology just tries to sensitize your mind to understand that okay, whenever you have a lab result, it is not only a lot of things usually take play a role in affecting the result. Did the patient fast adequately before sample collection? Was the sample collected from the right site? Was the right bottle used for the sample collection? So they were expected to also know like sample bottles. So I know a lot of time they used to be like, oh, you might not know this, you might not know that purple is EDT and all of this now, but or green is heparin. This is when you're talking about Vacutina and not Vacutina. But don't worry, when you do chemical pathology, because chemical pathology, they will hammer it in your head. You have to know order of blood draw. You have to know these sample bottles and what they are used for. You have to know even how to fill in lab forms. You have to know how to carry out some certain some certain practicals. Like in our exam, we're expected to carry out a urinalysis. So they gave us a urine sample, and we had and funny enough, that was not the only question. No, that is just one out of over 30 questions. I'll be 50. They say 15 questions, but each question had ABC under it. So like that was one question. Also, carry out a urinalysis, document diagnosis, likely diagnosis from the patients, and even sometimes they can go as far as okay, treatment and all. But basically, that was it. They even brought some lipemic. They brought a lipemic sample. They asked what could have caused this. They also brought they gave us some calculations to make, and there was an error because the value that you get was very low. So they were asked what might be the possible reasons for the error. So like you see what I'm saying, like for chemical pathology you have to fully understand the pathology. You have to understand the fundamentals. You cannot cheat your way. You cannot cram. to go and give it in the exam. It doesn't work that way. Even in the practical aspect, you have to understand the practical aspect, like what can affect my sample, right? What are the various factors, even down to the post-analytical phase? Could it be that the result was poorly documented? So that question was like an open question, but at the same time, it asked, okay, from your results gotten, what would you do with the result? So it's like an open question. Like, first you have to understand that, first off, the results that you got, the values are too low, right? So you have to indicate it there that the values are quite low. Then the question was, what will you do? Hence, because the values are too low, I would request that the test be carried out again. That was what I wrote in my exam. I request that so their questions is not, they will not give you something that you just say, "Ah, okay, Shasha, this is the answer." Sometimes they want you to think. This value that you gave me is quite low. Why is it low? What can be done about it? Then I wrote, the test should be carried out again. Simple. And why it could be low due to the following reasons: poor sample collection, um maybe the patient wasn't adequately prepared. Like, they would want you to think like a physician, right? And not just, that's why they say doctors don't treat, we treat patients, we don't treat lab results, right? So basically that's it. Then calculations to chemical pathology, they would want you to know how to do calculation from osmolar gap to anion gap, what can give you high anion gap, low anion gap. So they would want you to do a lot of calculations. So if you thought you have dumped your maths, go and pick it up. Go and pick it up. You are going to be doing a lot of mathematics in chemical pathology. So they want you to do that. Someone once told me that the bedrock of chemical pathology is electrolyte derangement, pH imbalance, and there is one more. These form the cardinal, the tripod stand for chemical pathology, right? So I will recommend the textbook of choice, Martin Cook. Honestly, I didn't like Martin Cook. It's as if me and recommended texts we are like this. Cause like most recommended, I don't end up liking it. I don't know whether I'm the only one. Like I said, if you have any question, you can leave it on the live, and I will get to it. As if me, I don't like recommended text because you can. So like it's as if I don't like recommended text because most of the times the I don't know, I just don't end up going with it, right? Maybe because of how, because recommended texts are usually, I don't know, they are usually not simplified for students. But like Martin Cook is the textbook of choice. It's a good book. Martin Cook is actually a good book because the little time I gave it a chance, like it actually impressed me, right? So Martin Cook is a good book, right? But I didn't really like Martin Cook because it was too much information. It has the relevant information, but like I just didn't really like it. I wasn't a fan of it. So I ended up reading Primer. Primer is an older book, older chemical pathology book. So Primer was a good book for me. I loved it. I was able to understand it, and everything flew like well enough for me, right? So I did Primer and I did some topics in Martin Cook, and that was what got me through chemical pathology. So guys, I hope that you've been able to pick one or two things from this live. I'm going to put that as a part one and a part two, and I'm going to push it more. These videos actually cover all the relevant things that you will need to know. So for video recommendation for chemical pathology, I would say just go online and search. To be honest, I didn't find a lot of, but I know I watched what is his name? Doctor. It's not Doctor Jambulka. Dr. Jambulka something. He's a biochem. He teaches biochemistry. But I told you when I started this, and I said that chemical pathology is biochemistry on steroids, right? Yeah. So what I did was that I watched his video. He has videos on liver function tests and kidney function tests. I watched some of his videos. I watched some, especially when you even come to renalysis. Apart from the dipstick method, they will also expect you to know the other method, though you will not use it that much as a physician, right? That is the other method where you do Bradshaw test, sulfur salicylic acid, and the rest, all those tests, right? So I know I watched his videos for that. He has some videos too. Honestly, you can watch Dr. Jambuka's videos though. His videos are very good. They would really help you in chemical pathology because, like I said, chemical pathology is just biochemistry on steroids. right? So if you watch his videos, like, you'll be good. I remember watching his videos for biochemistry, and I still watch his video for chemical pathology, because chemical pathology is just like applied biochemistry. So basically that was it for these courses. Now, um now this is going to be like a summary advice, because I'm going to be bringing this live to a close very soon. First off, I want you to read your mind. I've already done a video on pharmacology and some of the resources that I recommend. It's on my channel. It's on my it's I did a whole video, and it was a very lengthy video, so you could watch that. Also, the live before the one I had this morning, because this is the part two of my first live, right? The live before this one, right? I know I did talk about pharmacology in that one, so you can also watch that live. Now, when you come into part and farm class, I want you to read your mind of the mindset that the class is difficult, because I think that was a bit of what I struggled with. I struggled with the fact that, okay, because before coming into medical school, I already knew that second MBBS is not it. Like, the anatomy, physiology, biochemistry, that is not the hard part. It's the pathology and pharmacology that is the hard part. Because how it works in our school is, if you fail one of the pathology, repeat all four. So basically, you can't, like, for anatomy, at least, if you fail one, you repeat only that one. But this one, if you fail one, you repeat four. So, like, it was very, very crazy. So I would say that first off, you should read your mindset, like, have a positive outlook on this thing. Like, the class is not that difficult, you guys. If you have to believe it. You have to be delusional enough to believe that this class is going to favor you, and this class is not difficult, right? Once you're able to work on your mindset. I'm from Highford. I'm from Belgium. Thank you so much for joining my live. If you have any questions, please leave it down in the comment section below. I would really appreciate if you can help me share my live, like my live, and subscribe. Subscribe. Thank you so much for joining my live, guys. I really appreciate your presence here. If you have any questions, please leave it down below, or just say hi in the comment section so that I can call out your name. You have to first off believe that this class is not, it's not difficult. So pathology and pharmacology is not difficult, because if you are able to work on that, your mindset, right, everything starts falling into place. You start understanding things better, and all of that, right? You wouldn't have to bother so much, because most things are going to be in your favor. So another thing is that you should hold God tight. I'm a very religious and a spiritual person, so what I did, I held God tight. I prayed most of the time. This class brought me to literal tears so many times, and I saw myself praying a lot of the time, and all of that. So, like, holding on to God, you need to hold on to something tight even in this phase, and holding on to God was it for me. Like, holding on to God, and just the consistent prayers and hopefulness that everything is going to fall into place and I'm going to be favored, right? Another thing is that you have to apply yourself in this class. If you go to your practical sessions, don't just be seated there and watch other people do the practicals. In fact, at some point, if you attend my school, that wouldn't work so well for you, because at some point you need to perform the practical to be signed out. Like, if you don't perform the practical, you will not be allowed to, sign out. So please be engaged. Like, engage yourself in these practical sessions. Prepare your own blood film. For us, especially blood film, or like maybe when it comes to microbiology and hematology, when you have to view things under a microscope, sometimes the lab people will not let you sign out until they see, okay, like, you've prepared your blood film. You submit your blood film to them, that, this is the film I prepared, look at my blood film. Then they will give you a book for you to sign and go. So that one, you are actually forced to participate in the practical. But please participate in your practicals, because you learn not only from the books, you learn also from actually doing these things, right? So as you do these things, you actually, like, pick up lessons along the line. Then I would also say that just apply yourself as much as you can. Learn what you have to learn. If you have to use ChatGPT, please use your ChatGPT. Use your ChatGPT. When I say use ChatGPT, I'm not saying use it in the hall. My hand no day. Don't cheat. Don't cheat. Be very honest, because you're practicing to be a physician, and physicians are very honest people, right? So don't do that. Now, what I'm just trying to say is that, right? Do use AI. AI is here to stay. To be honest with you, AI is here to stay. So why don't you actually like utilize AI, like use it appropriately, like utilize it fully and wholly. You can use prompt, learn how to send in prompt on ChatGPT. I used ChatGPT and I used and there's another one. It's another one. No, I've forgotten the name of the second one. Is it dark web? It's not. I've forgotten. There are two that I use. There are two I use. I've forgotten the second one I use. But I heavily rely on ChatGPT. So I use ChatGPT to form my summary notes. I use ChatGPT to, you know, ask me questions as regards my topics, right? So sometimes I will go online, I will say ChatGPT generate questions, USMLE standard on neonatal jaundice, or ChatGPT generate questions, USMLE PLAB standard on hyperglycemia or like diabetes mellitus. Like so, it's usually it helps you, active recall. Or I'll say ChatGPT, I need a mnemonic on causes of high or low anion gap. Or I'll say things like ChatGPT, could you help me with a summary note on this topic? So ChatGPT is actually here to stay. So like use your AI tools, don't be left behind. Smart work is not hard work, hard work is not smart work. So just try as much as you can to, inculcate AI, inculcate technology, improve yourself, because like I've seen it, there's no reward for suffering. No, there's no reward for suffering. Some of these things are here to make your life a lot easier. So take advantage of it. I think tomorrow or next or subsequently I will go on another live where I'm going to be talking about some of the lessons that I've learned from this class. Like I said, these videos are like videos for my juniors, so something they can actually watch and actually learn, like okay, this is what is important for this class. I would try as much as I can to also upload videos subsequently, but until I upload videos subsequently, I think this video covers what is important and what this pathology and pharmacology class entails. If you have any more questions, please leave it in the chat box or send it in any of my comment section. I actually see questions from my comment section, so you can do that and I'll be sure to respond to you. Thank you so much for joining my live, everyone. I really appreciate your presence here. Don't forget to hit the subscribe button, hit the like button, and leave a comment for me down below. Share this video to as much people that would find it very helpful. Thank you all guys for staying this long. Bye. I remain Anika and I'm D. Bye guys.